Hi, I'm Dr. Rajani. Thanks for joining me today. We're going to dive into my clinic and we're going to watch a cat eye, fox eye, barbed brow lift. It's very popular. You could be in there all day doing them. People love them. They last variable amounts of times, anywhere from several months to a couple of years. Everyone's a little different. It's part of people's maintenance also now because the brow lowers over time. It's also why you get that horizontal line in the frown here that's not so easy because the whole complex is lowering. So the more we do to prevent, maintain, and give lift, and for the younger generation, they want the flare. It's an in trend, the Bella Hadid brow lift. So we're going to watch it. A lot of people like being in the clinic and hearing the bantering back and forth and the patients and the nurse talking and just the fun part of being in the clinic and aesthetics. This is a model who's not scripted to say anything specific, so it's all raw information of us just having a great day in the clinic like we always do. So we'll dive into the video. Let me know your comments, positive and negative. Never hurts my feeling. We always learn from the negative and from the positive. So aesthetics is not for everyone. Some people like looks, some don't. Some think we should never touch ourselves and we're beautiful from within. Inner beauty is the most important and the most beautiful. People have options now to alter the outer beauty. If people want to, it's great. If they don't want to, that's fine too. All interesting stuff. Let's dive into the clinic and watch a cat eye lift. 3 seconds. Okay, so we're going to cleanse the area, Abby. And then this is a little bit of lidocaine with epi. So just to help with the opening, and we'll make the opening right here, a little poke coming here. And then a little burn sometimes. You okay with that? Okay, let's come over to the other side. While we're here, we'll make one here. And the same thing here, a little poke. And that will help when we make the opening. It just helps with some hemostasis and makes sure that prevents a little bit of bleeding. How's the pain so far?
Not so bad.
Okay, I'm going to tilt you this way. Sometimes we'll give it a little time to work. And do you feel anything sharp here?
Just a little bit.
Okay, we'll make a little opening right here. Okay, so we're going to use a barb 5. Have you heard about these?
You told me the last time.
We put your name on them because these girls around here trying to steal them. I had to put Abby right on the package because they wanted them. So we're going to start with the thread part. We'll see how you do. If we need to put a little bit of anesthesia, sometimes what I'll do is I'll put a lidocaine on there. Let's do it so to demonstrate, because a lot of people ask me, what do I do for anesthetic? And what I do is I feed the thread right through into it. And one of the important things is to put the lidocaine through, so you know, I don't want a lot of lidocaine, and this is a larger gauge, not that you want to know that we're getting a large gauge here, but large, think of lift. And so I'm going to put this in. So we'll start here, and this is my traction hand, and you let me know how you're doing it, and I can give you a little anesthetic whenever we want. I think the first one, let's go straight up. You want a tail. You want a tail lift mainly. Okay, so let's come up here. Now you feel, you have good skin. We've been doing our work. You can feel a little bit of popping through here. You tell me if you have any discomfort. What I'm doing down here is I'm giving a little bit of lidocaine, and that will help create a little bit of an opening till I get running with the thread. And here I am here. Traction hand is my thumb, and I'm going to advance a little tiny bit of lidocaine. We don't want to flood the area, because even though these barb 5s have a double cut and they really hold well, it's nice not to have too much. And I just gently move it through. There's no need to be aggressive. We have all the time in the world. How are you doing with that?
That's good.
A little spicy?
No, I can only feel that much.
Okay. So I'm here at the hairline, which is really good. And when people are doing fine with it, I come up a little bit more. And now we're up here. So let's see, with the barbed fives, I can really have a lot of leniency. I don't have to be too aggressive because they hold. A little pressure right there. Okay, so set that thread through. And this is a 2.5 inch thread. And let's see with what we get for a lift with a single thread. Here's some lidocaine. And see what kind of pull we get. Okay. You up for one more?
Yes.
People keep saying yes typically. That's the normal response because most people know more is more lift, more is better. Okay. So this one we took through that vector. This one I'm going to come up a little more along a medial vector. And we'll put an opening here. And again, a traction hand. And just advancing it. Another way to do it is you can take the tissue and push the tissue over, and that will advance. A little bit of lido to create a space, and then a push. Can you feel it go through? It's kind of a weird, kind of a weird push. And here we are here into the hairline. We used to come from the hairline here, but I like these vectors. I'm going to set the thread, hold it, pull it out, and there's our two threads. And you can see our vector up here.
Roger that.
Did you get one iPhone back there?
Yeah, I got that serious look. That looks so good.
Okay, now what do you have in the
How
film?
was it? How did it feel?
I'm going to. I feel like I'm just
rub
wrap
it
it over.
Yeah,
To you.
looks good though.
Okay, Abby, side two. How is side one on a 10 being excruciating pain, 1 is almost none?
Maybe like 4.
Okay, so reasonable. Okay, a little poke you got here. Okay, and we got a little lidocaine on this thread, and now we have to match the other side. Okay, so this is going to be our straight vector. A little pressure through there. Any discomfort as I'm pushing? So I can, if you tell me,
No, I don't feel anything.
I can give you a little bit of lidocaine, but here we go. And then we're right up where we want to be, right up into the hairline. We hold. I do a little twist and then engage the thread. And we're ready for the final thread of the Hadid brow lift. And this one will go a little more medial. Trying to give you traction so we get a good camera angle here. And straight up. A little more medial with this one. You tell me and I can give you a little lido if you need it. It's normally. And right there. We're here, we can get a little lido. And then we'll get a little more gain. And we're right up here into the hairline, which is normally how we would have come down. So, hold, little twist or move, and we got our 2. Okay, now, before we set it, how high do you want it, girl? This is the time. You want it jacked right up? You want it so high, the highest? Okay, so as high as we can go. And it will relax a little bit, you know, that's how it goes. It's a little more dramatic at the beginning. So grabbing the thread, and I can feel, what I feel here is just kind of pop, pop, pop. And same over here. And just getting that lift. And sometimes if you want, you can use a little bit of like a gel to give you a little bit of as you're setting that thread so it's not so harsh on the skin, but I can still feel a little bit of lift. And then with the 4x4, finish it. It's a little cumbersome through the hair, but it's doable. Now, do we have a lift there? Do we getting a nice lift to that lateral brow? Is that what we want?
So good.
Okay, you can see yourself with the threads coming out, or we can clip them. Your choice. Clipping them is an extra couple $100. We usually send you home with them, so you can adjust them as you need. You know, you can be like, oh, I want a little more, weeks down the road. But in all honesty, clipping them is really important because it's a couple things. One, you don't want to clip the skin, which is common, and I'm pushing really hard here to set them, and they're not giving me much skin. I like to bury them. Burying them is really key to avoid problems. And then, so I'm taking my time because it's not, you have such good skin, and these threads have so much grab. I'm trying to loosen some of the grab at the opening to bury it. And people don't bury the threads, you can have a problem at the opening. So let's push, push, push. We're going to clip here. And this part's really important, counter to what we're doing, but it's important to bury those threads. So I'm pushing counter, and then lifting up. So let's set this side, lift, lift, lift. And then let's clip it. These barb 5s really have a lot of lifting power, and we can gain a lot of pull there. And then again, bury that thread is important. Set it up. Now you can feel, for a few days, you might feel that thread in there. And an important part is that when you get a little collection of blood like we had, when we hold a little bit of pressure, it goes. So it's really important. Same thing when we do threads, smooth threads laterally. We can see it, and sometimes a little bit of pressure will just help prevent it. So it's not bad when you're at home to do that too. So let's see, Jamie, if we let go of those and dab this side.
Have both sides there.
Yeah. And then you can sit forward for the camera and let's see what we have. You have her in view there. So what we did is lift this lateral edge of the brow. And part of the way you can tell she got a really nice lift is we lost the mid-arch brow a little bit in lieu of the lateral lift. That was more pronounced because this was down here. But we did do this tangential one, which helped lift that area. Grab the mirror and let's have a little look. This is the most important part of all procedures, by the way, because you're sitting there wondering, is it good or not?
It looks so nice.
What do you see?
I love it. It looks so nice. Thank you. It's like better than I expected.
Oh. Well, you're very welcome. It might settle a little bit, but these are going to build collagen around them. And the nice thing is you can repeat them as you want to. So
How often can I?
She's like, can I come tomorrow?
Can I do it again tomorrow?
Pin. So I think that's a great question. I think that a lot of people ask that. So how often do you do something like this? And the important part of knowing that is, for one, you can come almost as much as you want. You got to be careful saying that to people these days, but at 6 week to 8 week, you can repeat this, because my goal is this, not as much as what we did. We lifted it up, of course, but is that long-term collagen growth in this kind of vector. And that's going to occur over the next 6 weeks to maybe 16 weeks, and then the thread dissolves. But I often like to repeat things at about the 6 week mark, and then we let it be for 6 months to a year. But we don't want too much collagen stimulation, but with PDO, that's why we like it over PCL and PLLA in many cases. We can keep adjusting a little bit without worry. So when do you repeat it? It's always a loaded question, because some of the clients want to repeat it like the next day because they like it. And if you like something, what is it in life that you like that you don't want more of. Everyone wants more of things they like. It's the things we don't like, we don't want more of. But in general, 6 weeks you can repeat it. My guess is for you, the way you take care of your skin, I suspect 6 months to a year. But I know you're going to ask me in 2 months for more, and I'll probably give you more, but we won't let you hyperstimulate, and that's just the key. But yes, how long do you think you're going to ask me for?
Maybe 2 months.
See? I'm glad that the viewers get to see this trend of people, because it's understanding it. So there you go. That's the Abby Bella Brow Lift. Thanks for joining us today. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant. So thanks for joining me today. Hope you enjoyed that video. Let me know your thoughts. I'll see you next time right here, keeping your skin and body beautiful, healthy, and vibrant.